What's up, Doc Mike? Public Health on Call. By Johns Hopkins Bloomberg School of Public Health. Today's topic for November 20, 2020. Denmark's MINK situation and an update on pets and COVID-19. Thank you, Johns Hopkins Bloomberg School of Public Health.
Welcome to Season 2 of Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Joshua Sharfstein, Vice Dean for Public Health Practice and Community Engagement, and a former Secretary of Maryland's Health Department. Our goal is to bring scientific evidence and experience to the public health news of the day through informative interviews with scientists, community leaders, policy experts, public health officials, clinicians, and more. If you have ideas or questions for us to cover, please email us at publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Today, Stephanie Desmond talks to Dr. Megan Davis, a veterinarian and researcher at the Johns Hopkins Bloomberg School of Public Health, about how a virus that started in animals and spread to humans may be coming full circle. They discuss a recent coronavirus outbreak in the Danish MINK population that scientists worry has created a new variant of the disease that could potentially make a COVID-19 vaccine less effective in humans. Let's listen.
Megan Davis, thanks so much for joining me.
I'm delighted to be here.
So today I want to talk about animals and coronavirus. We've talked about this in the past, but the news that we've heard recently is about Denmark and how they are essentially killing all the mink in the country because they're afraid that they are spreading coronavirus. So could you please tell us more about that situation?
Yes, it's actually really an interesting story. No matter what you think about mink, whether you support or don't support mink production, Denmark is one of the leading producers of pelts in the world. And therefore, the mink industry has been really critical to them, and they've been trying not to do any culling. And I say that to put this in context because this story actually began months and months ago when mink were first reported to be susceptible to SARS-CoV-2, to the virus that causes COVID-19 in people. And they get some similar disease. They get respiratory disease, and that can actually be quite severe and can result in death. So they can actually get so sick that they die. So some of the culling is actually going to be because the animals are incredibly sick. The neighboring country of the Netherlands was among the first to report coronavirus in mink. And they have an industry where they had already decided as a country to kind of sunset that industry. So they were going to be closing the farms within a number of years anyway. And so when they decided to do a mass culling of all of their mink, it made sense kind of in that larger economic context, as well as a concern for the potential for the mink to, when they get infected, and they typically get infected from a worker who has it, that they could pass it back. And there was some evidence that showed that it could happen on farm to the workers, and also that the virus could be found in the air right around the buildings and could even potentially transmit to other animals on the farm. You know, you think about cats might be on a farm to help with rodent control, and cats, as we've already discussed, can be susceptible to SARS-CoV-2. So what's different about the Netherlands and what's important about kind of what's happening now is that it took a really big thing for Denmark to say, we might need to cull our industry. Because again, remember that this is an incredibly important industry to them. So what happened was they identified that there was a different variant of SARS-CoV-2 that they were finding in their mink. So it's bad that the mink were getting it, and they were going to need to, for humane reasons, conduct some interventions anyway. But when they identified this variant, they realized that the genetic mutation in it was on the spike protein. Now, without getting into too much about the virus itself, the spike protein is one of the targets for vaccine development. And they then went, because they have a very good surveillance system, they looked at the variants of SARS-CoV-2 that they were finding in their human cases. And they found some overlap between what they were finding on the mink farms and what they were finding in their human cases. And there was a novel variant that affected a number of people. And they found that in those people who had this particular mink farm associated variant, that their neutralizing antibody response was reduced. So when we're developing vaccines, we are counting on the production of neutralizing antibodies to help protect us from the virus. And so that was a big red flag. So that was concern. We haven't proven it yet, but there was concern that it could be that this variant would be more resistant and therefore would escape vaccination. And that's a huge problem, because if you think about thousands and thousands of mink that could potentially become a reservoir for a variant that may or may not work as well, in terms of the vaccine effectiveness, then you have the potential for that particular strain not only to affect people in Denmark, but to escape and potentially spread globally. Mm-hmm. And so this, response by Denmark, I think, is also quite well supported by the World Health Organization and the World Organization for Animal Health, or OIE.
So how worried should we be that these kinds of situations where we infect animals and then animals potentially infect us with a more dangerous strain, how worried should we be about this?
I think that there is cause for some concern, but I don't think that there's cause for panic. In all cases where we have zoonotic viruses, we have some worry that because they come from animals, and in this case, SARS-CoV-2 comes, we think, from bats, because that's where we find the closest relative to SARS-CoV-2 in wild animal populations. And we worry that it can get into animal populations, and we've seen that, cats can certainly get SARS-CoV-2 and become sick. Dogs also, to some degree, although they're more resistant. But the numbers there are teeny tiny, right? But with mink, you're talking about a farmed animal in, fairly close confinement. And so when you have introduction to a farm, it can spread more easily. We do social distancing to prevent SARS-CoV-2 spread among people, and it's really hard to kind of socially distance. If you think about trying to keep your mink 6 feet apart, you don't have barns that big when you're talking about thousands of mink potentially on a farm. So it's very, very difficult to do that kind of distancing, and so you very rapidly can get large numbers of animals infected. And those who survive may still carry the virus and spread it to new susceptible animals that come onto the farm. And that creates the potential for it to pop back out, for a worker to come into contact, or, for other routes of transmission to occur. In this case, we don't have any strong evidence that it's getting off farm through the air, because they've done studies in the Netherlands that really looked at kind of the distance away from the barn and identified that they only found positives relatively close to the barns. But in Denmark, we do have some people in the community who are found to carry the strain. And so we don't know if that is as a result of secondary transmission. So with that, we think a worker walks into the barn, gets exposed. And remember, we think this is originally from a worker, got into the mink, changed it a little bit, pops back out maybe into a new worker, and then that worker has contact with someone, and that person has contact with someone, and suddenly you can find it in a case that doesn't have any direct ties to the farm. So that's like the worry. So when that can happen, that's where our One Health surveillance systems are really critically important. And so I think what this highlights is the ability of One Health surveillance systems to give us an early warning flag. And so in that respect, it's really great news. It means that we were looking in both animals and people. We identified the potential for transmission. We also identified the potential for that transmission to have potential consequences for vaccines, even though that's, a little too early to say with certainty, but we have some evidence that suggests that. And therefore, they were able to make a decision at a very high level and institute an intervention. And so that's really kind of the mark of success in surveillance.
Mm-hmm. So this is what we worry about in flu, isn't it? I mean, we worry that we're going to get a bird flu or a swine flu that's going to be so powerful or so different that we don't have any defenses against it.
Right, exactly. So the name of the game with viruses is immunity. And with influenza, we have two ways of getting immunity. The first is we get exposed to flu variants all the time, and we develop immunity to these through natural infection. And then we try to target some. We usually pick about 3 for our vaccines that we deploy every year. These are seasonal flu vaccines. But typically what we're seeing are smaller changes from, one strain to the next, 1 year to the next, a little bit of a different mix. And where we worry the most is that we're going to get a bigger shift. And so with flu viruses, what ends up happening is that the pigs and birds have their own viruses, flu viruses, and that these can kind of recombine. So it's like going in with a blue hat and now you're coming out with a very different colored hat. And if your, surveillance system is looking for a blue hat, if your immune system's looking for a blue hat, they're not going to find it. And therefore, you can see more people getting sick. And sometimes the changes are enough that you can see, changes in the kind of disease severity or epidemiology. So who gets infected and how badly they get infected. And so that's part of why like swine and bird flu are a big problem. Now, I don't know that we've really identified that with coronaviruses that we're getting that kind of reassortment, where, things are getting all mixed up like puzzle pieces. But certainly there seems to be some kind of selective pressure that is either choosing or kind of pushing different variants towards these mutations. So we'll just have to see over time what ends up happening in terms of the role of certain animal populations in that.
And this could happen in other animals. We just don't know and we haven't seen it yet.
It could happen in other animals. And there was a really interesting study out of UC Davis as part of, I believe, the PREDICT project, where they were looking at the ACE receptors and doing a comparative analysis of ACE receptors in people and ACE receptors in all different kinds of animals. And so they've published on the potential just based on ACE receptor identity. So what ACE receptors are kind of more like the ones that would be a good target for this virus and which ones are different enough that they would be expected to be maybe not as great a target. So it's an early way to begin to maybe develop some suspicions about which animals may or may not be the ones to take a peek at. Certainly one of the biggest concerns is actually among primates. So these could be primates that are in a laboratory setting, or these could be, great apes, different collections that we are trying to preserve in the wild because they're threatened or endangered. And so there's huge concern around these particular groups of animals because they clearly have ACE receptors that are more like humans, that they could be very susceptible and that their populations could be threatened.
And ACE receptors are how the coronavirus attack us?
Yes. So the virus attaches to the ACE receptor, and that's what starts the infection.
Mm-hmm. So I know we talked about cats in the past, and I understand that, cats are a little more susceptible to COVID as we understand it, dogs less so, but ferrets are in the same family as mink. Are we concerned potentially about our pet ferrets?
I think that there is some cause for concern because when the initial animal experiments were done to see which animals were more or less likely to get infected, we identified that ferrets could be infected and cats could be infected. And other species like pigs were really fairly resistant, and dogs also were fairly resistant. What we see, though, in practice, when we look at, considering how many hundreds of thousands of people have now had COVID and how many of us have pets, it's estimated at over 70%. In the US, we have only, fewer than 50 or 60 dogs and cats, and the ferrets are actually not really on that list. So we haven't had a lot of reports from our veterinary surveillance systems for a lot of disease or concern in ferrets. And there's been at least one case where there were ferrets in relatively close contact, and I think it was a number of ferrets in this one household, and they were not identified as becoming positive. So that's reassuring. I think that I wouldn't recommend any ferret play dates, and I certainly continue to recommend that if you yourself have COVID-19, if you test positive for SARS-CoV-2, that you keep your pets, you just keep your distance, and that should apply to ferrets as well.
Well, Megan Davis, thank you so much for joining me.
It's a pleasure to be here. Thank you.
Public Health on Call is produced by Joshua Sharfstein, Lindsay Smith-Rogers, Stephanie Desmond, and Lamari Morales. Audio production by Spencer Greer, Niall Owen McCusker, Cian Oates, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Thank you for listening.